Good evening and welcome to Responding to COVID-19 on TTT, Talk City 91.1 FM, and TTT Live online on Facebook. I am Wesley Gibbings. Both the spread of the disease and actions taken to manage its impact are taking their physical and emotional toll on populations across the globe. Here in Trinidad and Tobago, there's a requirement to stay home. Business and commerce have slowed. Incomes have dropped or have disappeared altogether. Recreation outside of the home is no longer available, and the course of our daily lives has changed dramatically. In one of the more timely interventions by any professional organization, the Trinidad and Tobago Association of Psychologists has mobilized a network of volunteer psychologists and other professionals to address mental health care issues that have begun to arise. This evening, we are pleased to be joined by immediate past president of the Association of Psychologists, Dr. Margaret Nakhid-Chatoor, who is leading this effort. We also have on the line US-based Trinidadian psychologist, Dr. Karine Clay, who has been dealing with nationals from this country currently resident in the United States. Later in the program, we have behavior change therapist Wendell who will help us look at the impact of the pandemic on workers in the various sectors. Right now, we just want to give you a little clip, an extract from some information being put out by the Association of Psychologists.
COVID-19 has triggered symptoms of stress, constant fear and worry, difficulty sleeping, not eating properly. For some persons, drinking and smoking has increased, and there is a worsening of their health problems. We know that social distancing has been advised, but there are unintended consequences. Social distancing has increased isolation, depression, and loneliness. And depression can impact your immune system, increasing vulnerability to illness and disease. There are also social, emotional, and spiritual effects on persons which are not seen by media and public health officials. It is important to keep your distance from others and stay at home during this time. Social distance, however, implies isolation and a disconnect. So it is important to connect with others, elders, family, children, your loved ones via telephone, computer, your cell phone, or even your laptop. Increase talk time. Talk with people you trust. Tell them how you feel.
And we now welcome Dr. Chatoor and Dr. Clay. Dr. Chatoor, in that clip that we just played, you painted a scenario that sounds rather dim, but there is a crisis intervention team that has been entertaining calls from people who believe they require assistance. What kind of picture is being painted overall based on the feedback you have from these people?
All right, good night. Wesley, thank you very much for giving us a voice tonight to talk about this service. And as you previously alluded to, we have organized this hotline to help, because we have noted an increase in persons seeking advice on how to cope with stress, with anxiety, and how to manage during this pandemic. So far, lots of things are coming out of the data. So to date, as of yesterday, I have not tallied the calls so far today, but we have had more than 257 calls, 75% of which have addressed mental and psychological effects of this social distancing, isolation, fear, anxiety related to the virus, and inability to cope with family members. And unfortunately, conflict and abuse is on the increase. And among these 75% of callers, the over 6-day age group is the largest group of callers. And these persons are feeling there's this fear that they are going to die despite the safe practices that they have been doing.
No, we're going to get more into those statistics, that
Yes.
data in a short while. But I want to hear from Dr. Clay regarding her experience with TNT nationals in the United States. Dr. Clay, welcome to the program. Tell us what has been happening.
Well, currently I've been getting a great deal of calls within the U.S. as well as our Trinidad nationals in Trinidad and Tobago. But the calls that I've been getting in the U.S. have been from New Jersey, New York, and Houston thus far. The calls are from individuals who are anxious about their elderly parents that happen in Trinidad and them not having the ability or the opportunity to just fly home if they need them for any health reasons whatsoever. Another call was from a mother who has not seen her children for about 16 years. The kids were the age of 7 when she left, as many of our barrel children, which is what the coined phrase. I was also a barrel child when I lived in Trinidad. So I know that this mom is extremely depressed. She voiced being anxious. I had to connect her with a suicide counselor because she was definitely showing signs of wanting to do something more serious to herself. The level of anxiety and guilt is great for some of our nationals that are abroad and not able to access their family and don't know if this is the last time they may see their family. The nationals that are in New York City, one of the greatest things, as we know, we have nationals who may not be at work at this moment in time. And because they're not at work, their finances are low. Some of them are struggling with being able to get food because of price gouging. So as I said to someone earlier, a loaf of bread would have been $2. Now is anywhere between $7, $8, $9, according to what the price of the day is. So what little money that some of our nationals have are dwindling away because of the high prices for different essentials that they may need.
Now, Dr. Chatoor, some of what Dr. Clay has mentioned, there would have a corresponding impact here, because there will be the families who will be expecting the remittances, the barrels, the shipments, the funds. What kind of feedback are you getting when it comes to that? Those people who have families who are abroad, upon whom they might have been relying, and vice versa.
Right.
Dr. Chatoor?
All right. So a lot of the financial concerns that we are getting, so we established an overseas call, Wesley, because we realized that when this flyer went out, we had 20 people abroad calling us. So I know that Karine is dealing with, for example, those financial issues abroad. The financial issues which we've had here, especially between the 25 to 40 age group, is job loss, persons who have lost their jobs, young persons, entrepreneurs who set up new jobs, and now they're finding themselves without clients. And even though when they present these issues, we tell them, call the social assistance, access all these things, even though they understand that there is this, I think, reluctance to go that way only because it tells something about themselves, you know? So we have to explain to them that this is what the government is doing. And then when they do call the numbers, they're not accepting the relevant people. So that is a big thing that we have found. So in the other 20% of calls are persons who are not accepting these social services hotlines, so they're calling our numbers. And we know that those other hotlines, 877, where it's swamped, sometimes they're not accepting. So we have our own information about it, so we are able to allay their fears, able to tell them what to do. So in 20% of the cases, people are still calling us to find out what is there available for the government. Because they're scared, Wesley. A lot of them don't have jobs and all of that. And while we're on the financial issue here, I also want to mention that we had established a hotline for Spanish callers, and this was a very interesting dynamic, and I'll tell you why. All those persons who called in, and usually it would have been an employer or a friend who saw our number and told the Spanish caller to call in, they were interested not in mental or psychological issues, but in knowing how we can help them. Because here you have a population amongst us who are without jobs. Bars have closed down, restaurants have closed down, hotels, and they are in survival mode. So they cannot go to address mental issues when they are starving, when they don't have food. And I think more and more we are seeing where this pandemic in our society is causing grief, a complicated grief that if we do not address in the short and in the long term can have serious psychological effects on our people.
Dr. Clay, you are probably getting these similar kinds of experiences from Trinis who are immigrants in the United States. Some of them might be undocumented and may not have had their situation regularized. Is it a very similar kind of situation there?
It is extremely, but the biggest thing that Trinidad's TTAP, Trinidad Association of Psychologists, is doing that we do not have here in the U.S. is and you might be amazed by that, but it's a hotline that is actually dedicated to individuals who are being affected by COVID-19 for any kind of psychological or physical impact. Of course, we have hotlines for addicts. We have hotlines for individuals who are looking for suicide or even 911. But there isn't anything like the initiative TTAP has put into place for the hotline that is specifically for issues that are impacted psychologically by this crisis. And so, yes, you find that our undocumented individuals up here, they're even afraid. They're like, who am I supposed to contact? Where do I go? Even going to food banks, they are nervous and scared about because they're asking for identification for them to even be able to get rations of food from food banks. So the struggle is significantly real for our nationals all over the world.
And I understand when we spoke earlier, you said that you are even receiving calls and communication from people who are here in Trinidad.
Yes, I am.
What kinds of calls are you getting from the
Today
Trinidad?
alone, I received 7 calls, Wesley, that are specifically focused were individuals. Actually, one was from Tobago, some were from Diego Martin and Rima, and they were asking, you know, who do I speak to? Where do I go? I'm very anxious. I'm depressed. Some of them have already had pre-existing mental health conditions and they are running low on their medications. They're trying to contact their psychiatrist and they're being told that they have to pay for something. TTAP, we are not asking for any money. This is free of charge. 18 psychologists that are putting in their time. I am 3 hours behind you. So my day begins around 5 o'clock for Trinidad. And then it ends around, between 9 and 10. That's the time my day ends with the phone calls and the texts that I take. Because again, I'm nervous to turn my phone off because what if I miss someone that needs my assistance? What if I miss somebody and I can't give them that lifeline, however short it may be? I'm not there. They have no one else. I need to be able to contact them to someone else.
Now, Dr. Chatoor, in addition to TTAP, of course, you would have private practitioners and so on. How are they contributing to the assistance that the association is lending to the population so far?
Well, we do have private practitioners who have their practice, and they have reached out to us also because they wanted to know if they should have this face-to-face. So many of our practitioners have reached out to us. They are doing Skype conversations, over the phone conversations, and Zoom meetings because, you know, we have said be careful of face-to-face contact because we have had 2 of our responders who came down with symptoms, you know, flu and so we don't want to say. So we still have to maintain contact because remember, Wesley, when a crisis happens, mental illness does not go away. Trauma does not go away. It's still there, and it is exacerbated by the crisis. So instead, so that our practitioners still have to maintain contact with their clients, and I don't know as regards the psychiatrists, but I feel because we have had persons, even today I had a caller, a father who called about his son was on medication, and he tried to reach out to the psychiatrist, and no response was called us. And I'm hoping that the psychiatrist in this pandemic would come on board because we don't know how long it will last. And there are persons out there who are on medication, who do not have access to centers, to Mount Hope, etc. And we need persons in that medical field to respond to that issue. As far as possible, CTAP is doing that because we know the psychological issues and the triggers. But again, as I said, when a crisis happens, mental illness does not decrease. It increases and it does not stop. It's still there. It is persistent.
But in the process, have you been able to find out what the status is with institutionalized patients at St. Anne's, for example? What is their situation there?
No, I have not been able to find that out. I don't know what's happening with St. Anne's. I imagine that the facility is still running. I don't know if people are being admitted to the facility, but we don't have our handle on that.
Yeah, Dr. Clay, the role of psychiatrists in all of this, what role do you see for them at this stage?
At this stage, I would see, again, you know that your clients may not be able to financially are not able right now to pay whatever their fee is. At this time, we're supposed to be rallying together. Psychiatrists are my fellow colleagues that are out there. I think that you need to be joining up on this team and helping. So yes, volunteer some of your time, give up some of those fees. It's okay, because this is not, hopefully will not be forever, but the individuals that are being scarred by this crisis, the consequences of this is long lasting. So if we do not try to assist and help people cope, all of us rallying on, getting on and supporting our people, it's not going to happen. The consequences are going to be long lived, and we're going to have to deal with the domino effect. And when it comes to psychological health, it's not only the individual that's going through it, it's their family as well that is also experiencing this with them. So I firmly believe that our medical community within mental health needs to join on board and be supported.
Dr. Chatoor, have you been receiving a lot of calls from people who are on the front line, healthcare workers, people in the police service, and other support systems? We're going to talk a little bit more about this when the Leon comes on, but from the data you've been putting together, how many of these people account for the callers and people who are asking questions?
How many? What's your question again, Wednesday? I lost you there. How many people are accounting for?
The frontline people, the healthcare workers, nurses, doctors, and other people from and in that category, the police, people from the police service and so.
A lot of, some callers have called us who have actually referring some of their clients to us. So we have had doctors, first of all, in the first day calling us to see if they can access our hotline to their patients. Because again, doctors' offices were swamped with persons coming in with the flu-like symptoms, and they realized they were anxious and fearful that they would have contracted COVID. So we had doctors in the first week, and we still have doctors. For example, this week I had doctors who referred pregnant women because, again, in their last trimester, so they are fearful that their babies would be born in a situation like this. Today also I had security personnel, and I know some of my respondents have had persons who are fearful that they contract the disease and they be out there to help. I still have to tabulate how many persons we have received calls from responders thus far, but I know that they have called us to find out what is going on. I am very glad that the TPPS has our numbers because I have known that when persons call in, they have said, well, this corporate gave me a number. And I am glad that they are referring persons to us as far as Manzanilla, Mature, all of these areas. They are referring persons. So I know these persons who respond to crises know of our numbers. I am hoping that they themselves, if they are in need of our services, if they want to talk about their traumatic stress, they can also call us.
Okay. Dr. Clay, we have to leave you after the break, and we're going to go to a break now, but any last words before you leave us?
I wanted to just quickly share with everyone that I know that we are all struggling through this and that there are coping skills that you are able to learn. And I want you to know that if you reach out to a psychologist, it's not a negative reflection on yourself. It's showing your strength. It's showing that you are willing to say there are some things that you don't know and that you need help and support with. And that's what we're here for. Remember, your psychological health and physical health goes hand in hand. And I am waiting to hear from you as soon as you're ready to call. Thank you.
Very much, Dr. Karine Clay. Dr. Chatoor is staying with us, and she'll be with us when we come back from the break, when we'll be joined by Mr. Wendell de Leon. So stay with us. We'll be right back.
The following message is brought to you by the National Gas Company of Trinidad and Tobago Limited, at the forefront of energy. Practice social distancing and protect yourself against COVID-19 virus. Keep your distance from other people. Respiration droplets from a cough or sneeze can travel up to 6 feet and be inhaled into the lungs of the person within range. Protect yourself by staying out of reach. Make a conscious effort to avoid crowds. For example, if within range, think about walking or riding a bike to a destination instead of taking public transport. Keep your distance and avoid contaminated surfaces, because more people means the more surfaces get touched. For example, door handles, phones, remote controls, light switches, and bathroom fixtures. Don't hug or shake hands. If you have to meet with someone in person, find an alternative greeting. Tip your hat, wave, or offer a friendly gesture. It's up to you to protect yourself and your loved ones from the COVID-19 virus. The preceding message was brought to you by the National Gas Company of Trinidad and Tobago Limited, at the forefront of energy.
Hi, I'm Pastor Lisa Singh from Heavenly Grace Ministries in New York, and I want to take this opportunity to invite you to join me right here every Sunday morning at 7:30 a.m. We are doing a series on the imagination, and it is powerful. God wants to speak to you through your imagination, so please consider joining me every Sunday morning right here at 7:30 a.m. Until then, God bless you.
Knowledge is power. For students at home following the closure of school to contain the spread of the novel coronavirus, now you can view TTT and stream live on Facebook at TTT Live Online SEA Time, focusing on mathematics and language. All you have to do is tune in Monday to Fridays for mathematics at 9:15 a.m. and language at 1:15 p.m. SEA Time, Mondays to Fridays on TTT, and streaming live on Facebook at TTT Live Online is an initiative of the Ministry of Education in conjunction with TTT Limited.
Good, I'm more in the center now, right? Welcome back to Responding to COVID-19. I am Wesley Gibbings. This evening we are looking at the psychological impacts of the pandemic on the people of Trinidad and Tobago. On the line is Dr. Margaret Nakhid-Chatoor of the Association of Psychologists Crisis Intervention Team. And we are now joined by Mr. Wendell de Leon, a behavior change therapist. Welcome, Mr. de Leon.
Hi, it's great to be on, Wesley and Dr. Chatoor.
Dr.
Good
Chatoor,
night. Good night.
Hi.
Yes, sir.
Yeah, before we broke, we were talking about the workers on the front line and the challenges that they're facing. And
yes.
I was asking, what kind of feedback are you getting from these people? The healthcare workers, the police officers, and other public services, people in the public service who have to report for work, even though some of their colleagues are at home.
All right, I can only speak to the data that we have been receiving. And so far, those of us in these responding situations, these responders, etc., these healthcare workers, those who called in have been telling us that they are fearful of going out there. They don't want to go to work. One 41-year-old lady told me that she's thinking of making a will.
Wow.
That is her fear, that when she goes out there, something would happen to her. But I want to tell all healthcare providers, and they are also vulnerable. We don't think of them as being vulnerable also to experiencing psychological effects of this quarantine, especially when they have young ones behind and they go out there. And this stress is compounded by the stress of caring for sick people, for distressed patients. So I want to implore healthcare providers to take care of yourself, practice self-care, and most importantly, make sure your own basic needs are met. Because if you are not healthy, you will not be able to take care of others. You know, check in with your colleagues, check in with your loved ones, but take care of yourself.
Now, Mr. DeLeon, even at the best of times, it's difficult for the frontline healthcare workers. What kinds of discussions have you been having with any of them, and what kind of advice would you extend to them?
What I would like to do is echo Dr. Chatoor's perspective in that you need to debrief on a regular basis. Those healthcare workers on the front line, they are dealing with the brunt of the trauma for us. And at the end of the day, they are being denied their family, access to their families at times, because they cannot go back for fear that they might carry it back into the home. So some of them would basically quarantine themselves and continue working because of the risk involved. Internationally, when they hear the news that are happening out there and the risk involved with other healthcare workers, police, nurses, doctors, they too start developing the anxiety, hence the need for the regular debriefing where they can form groups within themselves and be able to talk about it outside of just the lack of PPE and other things that may be an issue. There is a need for them to deal with the psychological fallouts where, as the frontline workers, they struggle with that. They don't get a chance to say what they may be experiencing because they don't have the time to do that. They have to just deal with what is in front of them. But at the end of a working day, they struggle with, how do I then deal with this as my own mortality, my own reality? And sometimes just making a phone call to home and hearing your loved one centers you to be able to go on for another day.
Now, Dr. Chatoor, you know, one of the things that has been happening, and I'm out of shift to even people in my own profession in terms of media work, there are people who are becoming, in a sense, super saturated with COVID-19 news and information. It's pretty obsessive, and they internalize a lot of the data that's reaching and information that's reaching them. What kind of advice would you extend to them?
As you correctly said, overall, not only those in the media, overall, information, too much information is causing panic, especially when some of this information is not correct, or what we call fake news. So we would advise, unplug the TV, take a break. Self-care, especially to people in the media, because you are in it. You are in it. You know, you are seeing everything, and you yourself, media personnel, you have to decipher what you're going to put out there and what you're going to hold back. So self-care is important, protecting your mental health. And I imagine we haven't had any media personnel calling in. They seem to me to be very ebullient, and you know. But it is good, I think, in all of this to communicate with your colleagues and to establish some kind of connection. Because you see this phrase, Wesley, social distancing, it is so misleading.
Yes.
All right, we want physical distancing to happen. We want you to stay at home. We want you to, you know, keep distance from others. But we still want you to not be socially isolated. We want you to connect with people via all of the telemethods that you know. And once people hear social distancing, it increases the loneliness. Now remember, we have people in homes that are already lonely, that have already experienced all of this isolation, and to bring this kind of dynamic to it increases fear. This morning I had a caller, 12:15 after midnight, and she couldn't sleep. She was in a home, all the family was up. She was up, her brother was up, her parents were up, and she could not cope. She called me from Princeton, and she said, I cannot cope anymore. I'm fearful for my parents. And again, I imagine the media attending to all of this, people listening to all of this can really, as I said, long-term have serious psychological effects. And one thing I want to bring in here, there is a collective grief. I don't know if you noticed it.
Yes.
Because with this kind of pandemic, people have lost their own ability to control the situation. There's no longer control, because you can't go places, you can't access services. So they have lost that control over it, and there is, as I said, this collective grief that we needed to attend to, not in the long term, but now.
Mr. De Leon, I want to stick rather selfishly to the issue of the media workers. When I spoke to Dr. Chatoor earlier today, I used a word that generated a bit of a chuckle, but I think it's a serious thing. I told her at the time that I was spending a little time decodifying.
I just chuckle is a nice word, Wesley.
Because, just extracting myself a little bit. Now, fortunately, I have that option, but a lot of my colleagues don't have that option. And you talk about people who are sleepless, and you're talking about people who are hyper-saturated. You're talking about people who are following this as a story for their job.
It is a lot of information, one, and one of the things I want people to be mindful of is every person have a different threshold. And if we're not respectful of that threshold, you can see workers also getting, especially frontline workers, where some of them feel that I am doing more and I am being pushed more to the front and I am more at risk. And should somebody contract COVID in that process, they would be angry with their colleagues. So people have to be mindful that not everybody could go at the same pace. Not everybody could be exposed as much. Some people, their threshold for burnout would be much lower than others, and we have to respect that. For those who may not want to come on the front line, can we be upset with them? We also have to look at innovative ways of supporting the frontline workers. So while I know you're saying you want to look at the media workers who have been doing a tremendous job, as well as the nurses and everything to carry the news, they too will suffer from that burnout. They will become hypervigilance, and the mere word COVID would just get them in a frenzy, because they don't want it. Is a point where enough is enough, but we haven't even gone past that point yet. So you could imagine if we should then start to get to the top of that bell-shaped curve, where it can be additional cases, possibly more deaths, and those are some expected kind of things. What is going to happen to people who have already reached that point and said, I can't go anymore? This is a reality that we are facing, and people need to know when to pull themselves out and to let others probably take a space, and to, self-care. And I think Dr. Chatoor keeps saying that self-care is critical at this point in time, and nobody could determine at what point you have had enough but you.
Dr. Chatoor, while we're on the same kind of topic, there are people now belonging to a category that's being described as essential, being involved in essential services, the provision of essential services. Mm-hmm. What is there special attention that needs to be paid to them? You have people who, for example, they would be working in the garbage collection. There would be people working at the service stations, the supermarkets, and they're out and about, and they're doing this and providing, very, very important services. And I think there might be a tendency somewhere to take them for granted. Are you coming across a lot of people who want to talk about their experience in that, in those roles?
Not many, but when Wendell was speaking, I imagine with these healthcare providers, Wendell, if we are not careful, there would be a stigma from others, because as you said, they are working on the front line, and their neighbors know this, their co-workers, their friends know this. So I could imagine there could be a stigmatization and rejection, and even family members, because here you are working with others who may be exposed to infections. So I could see them being, people avoiding them, excluding them, and they having these kinds of fears that they themselves possibly could could be susceptible to infection. But I want to also say here that these healthcare workers, I wrote an article and I said they should really, at the end of the day, be getting, I mean, I'm not an industrial person here, but be getting bonuses and be recognized and really get a little boost so that there is this kind of gratitude we show them. Because you're hearing all of these stories, and I was reading today that the majority of persons, these healthcare providers, these doctors who are dying, are also in the over 50-plus age group. And these persons are exposing themselves to disease. They're coming home. So we need, even if it is not to give them tangible rewards at the moment, let the government recognize, and I know they have to do it for them, but recognize that these people are putting their lives on the line in the service of others. And that service thing is something that we have to really attend to, Wesley, in significant depth. I think this isolation can really move us away from the fact that there are persons out there who need our help, even though we have quarantined ourselves. There are persons there who need food, who need services, even if it's to do a drive-by, drop off a bag for somebody. But healthcare workers, persons out there, I think this is a good time to recognize them, to support them, and hopefully in the long run to give them extra bonuses.
Just a little personal anecdote here. Before the stay-at-home instruction, I cheated and I went to get a pizza. And I was in the place, and there was this lady with a very young child, probably about 5 years old, and a nurse came through the door, and the little child recognized this lady and was calling her Auntie something. Auntie Leah, I think it was. Auntie Leah. And her mother shouted behind her and said, no, don't touch her. And I paid attention to the nurse, and the look on her, she knew that it was the proper thing, but I looked at the expression on her face, and it was a most amazing kind of expression. And I think that if you multiply that several times in this current phase, that's what a lot of the nurses and other healthcare people are going through right now.
Yes.
And I think that highlights the point you're making. Yeah, in terms of the stigma. Not only, but it's appropriate action, because the mother was concerned that the child will touch the uniform of the nurse, who is her aunt or whoever, and would contract the disease or something. So people are going through that. So, Mr. De Leon, lessons from all of this.
Well, one of the things I want to throw inside the mix there is the need for those people who are at home and struggling with cabin fever, those who don't know what to do with themselves. And I think it's time that they know how to join the fight while at home. There are some people who staying at home is and being able to say, okay, you have joined the fight by staying at home, but tell me, I can't stay at home and do nothing. And there are lots of opportunities that you can safely stay indoors, and you can be able to get involved in stuff. So you might have the police and the nurses on the front line who may not be able to cook for themselves and who may not be able to prepare meals. But between you and some other people, you all can probably not meet, but through the phone, arrange that somebody could cook. There is a pickup point. There is that, curbside kind of arrangement. So people feel like they have a purpose, and that they're contributing to it, rather than I'm home. And I mean, outside of those who are self-quarantined and they have to be by themselves because we all know that they may have contracted it as a case, but those who are not quarantined and they're home and they are practicing safely staying indoors, I think some of them can get involved in the fight and to make themselves useful, because that will help them to stay indoors for the most part, as against wanting to come outside and engage in other kind of activities. So telling people that they could just stay indoors, there are people who have used up all of the emotional energies to keep themselves at home. And they are now running out of patience. They want to find things. And then we also have the issue that I would have mentioned earlier, in the concern of domestic violence increase, where people don't have the best of relationships. So it's a struggle to stay indoors and to stay in the home and to stay in the space, because it is now becoming tense and it is becoming awkward and uncomfortable. So we have a number of those things that has to be addressed, and we need people to find safe ways of coping through this time, rather than they put themselves at risk and others in the process.
Dr. Chatoor, are you getting the domestic violence calls?
Oh boy, we're getting abuse, we're getting parental abuse, we're getting relationships that are being frayed, we're getting a lot of women calling in, and it's something else. So again, what we do in the first instance is promote calm, promote hope, help them to manage all of these reactions and so. But I'd like to say and piggyback on what Wendell is saying there, this is a period which can elevate anxiety and depression. Loneliness alone can impact physical health, but I'm hoping that persons also see this as an opportunity to maintain interpersonal connections with others, see this as an opportunity to appreciate and to thank people for being in their space, to love and to support others, because this is an invisible pandemic that we're not certain as to how it will turn out. So let's take the opportunity to really, as a community, as a collective, help each other through interpersonal relationships via social media, etc.
Okay, Dr. Chatoor, we have to wrap up now, but very quickly, where can people go to get the information, the numbers to call and so on?
All right, so on our website, that's psychologytt.org. We have all of the numbers, and again, remember that we are servicing all of the areas, east, west, central, south, Tobago, Spanish callers, Trini callers in the US. Go onto our website. We have flyers circulating.
Dr.
Even
Chatoor,
if it is not for you, for someone else.
Yes, we have to go. Yes, we have come to the end of this evening's edition of Responding to COVID-19. I'm Wesley Gibbings saying thank you to psychologists Dr. Margaret Nakhid-Chatoor and Dr. Karine Clay, together with behavior change therapist Wendell de Leon. Thank you very much for staying with us. Have a good night.
The following message is brought to you by the National Gas Company of